Hi, good morning. My name is Dr. Benham, and thank you so much for having me on your show.
Well, I'm so thrilled to speak with you all the way from Los Angeles, no less.
Yes, the weather is beautiful,
Oh,
typical 75 degrees. I'm not making anyone jealous out there, but I was just talking to a friend of mine in New York, and it's much colder. So we are
uh,
blessed to be here.
you are indeed, and I have visited that part of the world in the past, so I do know how privileged you are to be living there the whole time.
Except for taxes and everything and some of the other
Oh
issues, it's
yeah,
a great place to live, honestly.
yeah, yeah. Well, so we're here today talking all about hair, and for women in particular, around the time of menopause, we can experience shifts in the health of our hair. For some women, thinning of the hair, that male. What do you call it, Dr. Ben? Tell me.
So it's the female pattern hair loss.
That's right. Yes. And that can be a feature for women around this time of life. Not only then, though, sadly, this is something that women, it's a struggle for women, I think, in particular. I know from my own personal experience that, a lot of my identity is tied up with my hair. And without my hair, I don't know that I would feel quite like me.
Yes. So see, typically what happens that around menopause, females go through a lot of changes. And unfortunately, as a result of that, um, they could experience some shedding. And a lot of those female patients already um, have some genetic predisposition for hair loss. So when you
Mm,
start going through those shifts and changes in hormones, basically it just kind of accelerates some of that genetic predisposition.
ah,
And also usually around 45, 50, I think a lot of people are going through some other stressors in their life, whereas in your 20s you're
mm,
not, you have kids are growing older, they're rebelling more, I have two of them, so and that already adds more stress. You're going through midlife
mm,
crisis,
mm,
and your parents are getting older and now you're worrying about your parents' health, so I think there's a lot of stuff happening around that age, and it's a combination of everything basically that's going to push you towards more of that hair loss phenomena that most patients experience
mm.
around 45 to 53.
Right. So, what your experience is that you set up a wonderful clinic with your brother. I mean, I don't know that how that works, working with your brother all the time.
So believe it or not, so the thing is that he's so busy and I'm so busy. So Dr. Sean is
Oh,
always doing surgeries. So yesterday, literally, I saw him at 5:45 as we were just leaving the office. Can you believe it? So we barely see each other sometimes. But it's great because we're always there and we're always there to support one another, especially with respect to when it comes to patient care.
mm,
And yesterday, like, he had a patient who came from Mexico City, flew here to see us, and we always
um,
bounce ideas and other treatment protocols because he mainly does a lot of hair transplants, and I do like a lot of like PRP and what's called platelet-rich plasma stem cells, and sometimes patients want to blend the two together. It's kind of
mm.
bridging these two worlds, and both of us being the same clinic allows us to give that kind of the best care opportunity to our patients.
Yeah, well, it does sound like you have two skill sets that complement one another perfectly to help your patients, as you say. So, you know, we're talking about keeping hold of our hair in the first instance, if we possibly can. So, what are some of the good things that we can do to support our hair, and maybe some of the bad things that we should stop doing?
That's a very good question. So first of all, prevention is the key, which means that if you could do anything to keep the hair, that's the most important thing. So a couple of things that we could do to basically maintain the hair. Number one, reduce stress. Honestly, I truly
Um,
believe that stress is one of the main cause basically of hair loss. And I'm gonna basically go back to what I said earlier. A lot of people are genetically predisposed to losing their hair, but as you
right.
go through stressors, basically that's gonna accelerate the underlying stressors. So like I have like a lot of patients that come and see me in their 30s and they look amazing. I'm like, you know what, you're gonna keep your hair. Unless one thing happens, you go through like a
Mm,
major stress, like a car accident where you end up in the hospital for 2 weeks, divorce, like getting
Mm.
fired, things like that. Some of those stressors we have no control over, but the more you could do to minimize it, basically, the better it is. I always make the joke, go to Hawaii and take me with you. That's I think so. Being in an environment where it's quiet, tranquil, that really makes a difference. So stress
Mm.
is one of those things. So reducing that. So kind of having, like, if you go running or exercising, it that releases some of your stress. I think basically those are the best things. So that's number one. Number two, other stuff that I could do basically to kind of prevent it is, for example, like a lot of people basically shower, twice a day every day, or they shower or shampoo every day. And I think
Wow.
basically that's actually pretty bad. We typically discourage patients from showering. Well, no, you should shower, just don't wash your hair with shampoos every day.
Okay.
Excessive use of shampoos are bad for you. So, and I have patients who literally cut down to only 2, 3 times a week, and they already automatically tell me that their hair stopped falling quite a bit.
Oh.
So washing excessively is not good for you. Conditioning is good, so we always do encourage using the conditioner. Look, I shower every day, but I don't wash my hair with a
Mm.
shampoo every day. You would just wash it out with water. I mean, I actually have quite an
Yeah.
oily hair, but I just wash it out all the time. By the afternoon, it gets kind of quite oily, so I have to, you know, um, shower every day. But so that's another thing. Another thing is that, when you kind of shower, you don't want to be too aggressive with the hair, so you don't want to
Yeah.
wrap a towel really tight and really, or like brush it really hard. Those are things that you should avoid doing. That's very important.
Mm.
And then some of the proactive stuff. So, for example, taking your vitamin D every day is very, very important. I usually say there are four pillars of hair loss. Number one is vitamin
Mm.
D. You need to take it every
Oh,
day. You
yeah.
could do whatever you want for your hair, every PRP, every stem cell treatment. If you don't have those basics down, it's just not gonna grow. It's you need the foundations.
Mm.
So vitamin D 2000 IU's is typically very good. For
Wow.
females, I typically do recommend doing an iron tablet every day. The problem with iron is that it could be constipating. So I typically
Oh,
recommend
yeah.
some of the lower doses, but just be consistent about it. That's another thing. Being consistent about what you
Mm.
is very important. So taking a regular multivitamin, I typically, like the prenatals, I think they're pretty good. Adding on a separate vitamin D and a separate iron, I think those three things are very important. In addition, adding collagen to your diet is great. Whole Foods in the US has the Vital Proteins collagen, which is easy. It's great. Just one scoop a day and drink it. You can even mix it with your tea or coffee. And then
Mm.
adding more protein to your diet. So your
Mm.
hair is composed of proteins. So the more protein to add to your diet, the better it is. And for example, adding more cashews, chicken, walnuts, avocados, those are great. But also you could buy a separate protein powder and literally make a smoothie out of it. And there are many different protein powders out there, so
Mm.
I'd like to kind of elaborate about that. Um, there are pea proteins, which are all fine. It's great.
Oh,
But
yeah.
there's also whey protein, which are very popular. There are two types of whey proteins. There's the concentrate version and the isolate version. Whey protein isolate is one of the most common whey proteins, at least in the United States. It is
Yeah.
mainly used for muscle building, so that's why it's
Mm.
very popular. The problem with the isolate is that it could actually cause more hair loss.
Ah,
So you don't
yes.
want to do, you
Mm.
always want to look at the back of the ingredients, and you don't want to do the isolate. You actually want to
Right.
do a whey protein concentrate. Uh, it's tough to find a pure concentrate in the States or really anywhere else. But Amazon, they have a lot of options. So I always say get a whey protein concentrate, throw some collagen in there, do a smoothie in the morning. Skipping breakfast is a meal replacement. It's gonna do a couple of things. One, you're gonna lose a couple pound of weight, actually, which is always a good thing for everyone. Number two, is actually gonna really help with the hair growth. And I have some female patients that come in, and honestly, all we do is just put them on proteins and collagen and vitamins, we see them back 4 or 5 months later, and they say that they're better, really, without doing any prescription drugs.
Mm. Well, I like the sound of that because I do favor natural approaches wherever possible. And I do have a very appealing shower cap in my possession, which, yes, I wear. So I do, as you said,
I love it.
I definitely am aware that my hair is healthier when I don't wash it every day.
every day?
And
Yes.
yes, so we are in the shower, like you said, but I do have this pink spotted shower cap. It's very
Nice.
attractive.
I
Yeah.
love it. I love pink spots. That's great.
So yes, too. I like to wash every third day,
Mhm.
and my hair that is, and so yeah, I definitely noticed that. But I wasn't sure that that was the right way to go about it because of the scalp. The health of the
Yeah,
skin of the scalp. So that was something I wasn't wholly sure of. And we'll come to that because
sure.
you said such a lot then, actually, quite quickly,
Yeah, sorry.
about.
I get sometimes too excited about this,
I
so
know.
pardon
Well,
that.
it's exciting. I can see why you would get excited. But the whey protein is something I'm familiar with because my son is a bodybuilder,
Mm,
and yeah, so I'm not particularly keen on it, and I keep trying to steer him in the direction of the pea protein.
pea
But
protein, yeah.
yeah, he says he can't find one that tastes very nice.
I
So
know, but he could do a whey. I know, yeah, that's true. But he could do a whey protein concentrate. He could
mm,
do a concentrate version of the whey protein. And a
yeah.
lot of muscle builders actually are slowly transitioning into that. Now,
Oh,
another
that's
thing
interesting.
is creatine. That's also
Oh, oh, he
really
does. Oh
bad.
no. Oh,
Really horrible for your hair.
oh,
It
is it?
shoots up your testosterone level. I do have some
Oh,
females that are bodybuilders, and I'm telling
mm,
you that, you know, creatine will cause a lot of shedding in your hair. And as simple as that.
ah,
And another thing, soy, actually, a lot of soy is also not very good as well. So tofu
oh,
and a lot of soy, just because it kind of messes with your estrogen and testosterone
mm,
levels. So, so we would
yeah,
kind of, a
yeah.
little bit here and there is fine, but really, like, some people try to replace their regular milk with their soy milk. I usually discourage it.
Yes, yeah, yeah. Okay, well, and I love this idea that we're nourishing our hair from within,
Yes.
with natural approaches wherever possible, and just so to take us to the skin of the scalp, because you are a dermatologist,
Mhm.
and so I'm quite sure that you've got some really fantastic tips for us.
Yes, great question. So the skin on your head, the scalp. So it's really important. I think there's some myths and some, things that we kind of gotta let's explain about it. So one of the common things that I hear is that patients come in and say, "Well, doc, I'm losing my hair because my hairs on my scalp are plugged up." I hear that all
Okay.
the time.
Oh,
That's actually pretty interesting. And one of the reasons why people think that is because a lot of people have dandruff in the scalp, and so it's flaky and it's scaly, and you kind of scratch your head and you see all these crusty things under your nails. And yes, it gives that impression that if your scalp, has a lot of dirt on it or stuff on it, it's going to plug up your hair and your hair is not going to grow out. It's an interesting concept. I don't really agree with that, but I do believe that a lot of the flakiness on the scalp is dandruff, and
mm,
dandruff is usually fungus, and it's sometimes
oh,
associated with a lot of inflammation, and it's the inflammation
mm,
that will damage your hair. That is
mm,
true. So, and some patients that have psoriasis on the scalp, which really thick, scaly, inflammatory lesion on the scalp, those patients even have more hair loss. So, in those
ah,
situations, I do believe that you have to take a good control of the inflammation and the dandruff on your scalp. And by reducing the inflammation, by reducing the redness and controlling
mm.
the flakiness, you actually do have a healthier scalp. And as a result, I think you will have just better hair growth and less fallout because you're reducing the inflammation. So by reducing inflammation, there's less damage to your hair.
Yes. Okay. So are we talking about applying things to the scalp locally, or are we talking about systemic inflammation, or is it maybe a bit of both?
So it's sometimes a bit of both, but typically it's just localized to the scalp.
Okay.
Um, and there are ways they could treat it. I mean, you could use antifungal shampoos. I usually recommend not using solely one shampoo. It's actually better to alternate a couple different shampoos because just like bodybuilding, where you should not do the same exercise every day. You shouldn't use the
Mm.
same shampoo on your scalp every day either because your scalp gets used to it.
Mm.
So alter the shampoos, kind of move it around like every other day, use a different shampoo, and just put it on for 5 minutes and wash it out. And by reducing the inflammation, the flakiness, I think you just have better scalp health, which results in just better quality of hair. Now sometimes if there's a lot of inflammation, then you do need some topical steroid on your scalp. And
Ah.
dermatologists will write that for our patients and recommend it. But everybody's different, so you have to see a
Mm.
dermatologist so that basically they validate you. Talk about systemic inflammation. There's certainly conditions where the systemic inflammation does affect your hair. So I personally have a hair loss condition known as alopecia areata. And what it is it's kind of like an autoimmune condition where the body attacks your hair follicles. And it's all
Ah.
inflammation because if you were to do a biopsy, you will see all this inflammation underneath the skin. So we know it's inflammation, but for some reason, it's just systemically showing up only on your scalp and causes hair loss. Basically,
Mm.
all of the scalp, you could get hair loss on your beard area, face, legs, arms. And believe it or not, I have a lot of female patients like that. But in that case, that's like a medical
Oh.
condition that needs to be treated
Mm.
with localized injection of steroids to reduce that inflammation.
And what did you call that again?
Alopecia areata.
Areata.
Yeah,
Oh,
it's
okay.
very common. So if you look at guys, if you're
Mm.
outside, right now everyone was wearing a mask, but before the mask era, if you were to look at guys, you will see some guys will have like a patch of hair loss on the beard. Very, very
Oh.
common. A lot of females have it too, but they tend to hide it much better than guys.
Well, I'm certainly trying to hide my beard.
I'm talking about the hair loss, but yeah, I get it. Yes.
Yeah,
Yeah.
I want it on my head
Yes.
and not on my face. Thank you
Not
very
there,
much.
have everything there. I 100% agree with you. Yes. Let's keep everything up here and nothing down there. I get it.
Yeah.
Yes.
So I guess there's a difference between alopecia and female pattern baldness.
So alopecia is just a generic name for hair
Oh,
loss, and
okay.
there are
Oh,
many
okay.
different types of
Alopecia.
hair loss. Yeah, so there is female pattern hair loss is actually known as androgenetic alopecia. But then you have
Oh,
other type of alopecia. So they have alopecia areata, where you have these circular round patches that you get. Then you have cicatricial alopecia, which is scarring hair loss that mainly happens in like darker skin individuals, kind of like in the crown area. So there are a lot of different types, but alopecia is a generic name. But we're talking about female pattern hair loss, so also known as androgenetic alopecia.
okay. Well, thank you for clearing that
Of
up.
course, no problem.
So we were talking about pea protein a minute
Yes.
ago, and so I'm just curious. Obviously, dietary considerations. You've mentioned some vitamins already that would be good for us to perhaps supplement with, but some people choose to opt for special diets.
Right.
Vegetarians and vegans. Veganism is really quite fashionable at the moment, if I
It
can
is.
say.
It is. Yes.
Mm. So do these have ramifications for the hair?
Absolutely, because unfortunately, when you are on those special diets, what happens is that you're not getting enough nutrients, amino acids, and vitamins, and you
Mm.
tend to have more hair loss. So every
Mm.
time somebody comes to my office, we usually ask them, if they have any like, are they pescatarians, are they vegetarians, and I'll tell you, a majority of those patients who are vegetarians don't have very good hair. So I
Mm.
always say, look, supplement, add,
Mm.
use the protein, use the collagen, use the vitamin D, just add more protein to that. Because again, at the end of the day, your hair is all proteins, guys.
That's
It's all
what it's
protein.
made of.
I just
Yeah.
noticed a wrinkle on my forehead. Sorry, my Botox is wearing off, but it's all good.
Do you do that in your clinic as
Yes,
well?
absolutely. I've been
Oh,
getting Botox on myself for the past 20 years, and I'm proud
well,
of it.
well, good for you. I think by preventing the wrinkles from sort of taking a hold, isn't it?
Yes.
That's what you're doing by doing it regularly.
Look, exactly. It's all about looking. I think
Yeah.
you feel great if you look great. So I always say, don't overdo it. Do very minimal, but A little bit here and there doesn't hurt anyone. It's all good.
No, yeah, it's what it's horses for courses, as we would say in this country, or each to their
Yeah,
own.
each to
You
their own.
know,
That's true. Again, but I
yeah.
do live in Hollywood, so I have to kind of, look good.
Well, you're conforming, aren't you?
Yes, yes, but not too much though. Keep it simple, keep it
Yeah,
looking good. I mean, I
yeah.
sadly I see way too much
Mm,
patients that are just overdone,
overdone it.
sadly, unfortunately.
So, well, collagen is actually something that I've been supplementing with relatively recently, and I do feel like it is changing, the voluminous, the
Mm,
volume of my hair. It does feel healthier for sure.
yes.
And so, would I don't know about you. Well, I think I do now, actually. Trying to stay visibly younger without breaking the bank.
Yes.
Mm,
And not looking too weird. That's really the
yeah,
balance.
yeah,
At least in
yeah.
LA. In LA, that's the balance. Yeah.
I don't have to worry quite so much in Lincoln where I live.
You look great. You look great.
Oh, well, thank you. I'll take it.
Yeah, so it's kind of, trying to keep that balance. And again, with hair, I mean, what has become in the past 5 years is that a lot of things have changed. First of all, like about 7 years ago, we were mainly seeing 90% males and only 10% females in our practice. But over
Oh,
the past 5 years, demographics have changed because, see, it used to be a taboo for females to talk about hair loss. You just
yeah.
never heard it. See, years ago, Michael Jordan shaved his head, and you know what? It made it good. Guys look good with shaved head.
Mm,
They do. But ever since Instagram and Facebook came out, and the younger generation, they're taking 20 pictures a day, whereas when we were younger, we barely took any photos. So for them, looking great and presentable on Instagram is very important for
mm,
both males and females. So the rise of Instagram and social media has made female pattern hair loss less taboo, which is actually a good thing. It's a good
mm,
thing because you want people to come and talk about it,
mm.
and you want people to talk about it and not be embarrassed about it. Because when you talk about things, then you could talk about treatment options.
Yeah, and I think that is really why we're here, actually. Joking apart, that to get rid of taboos, whatever they might be, reproductive health,
Yeah,
hair,
yeah.
whatever it is, hair loss. Let's put that to the side and see what we can do to help people who have issues or difficulties. And so uh, you're saying that more women are presenting themselves at the clinic, and are we meaning for the hair transplantation sort of services or
It's both. I mean, it's both
both?
just medical hair, but it's actually three things: medical hair loss treatment, injectables, and hair transplant. You really have all three segments, and sometimes patients don't know what they want, so they just
No.
don't know, so they come for advice. And sometimes
Yeah.
patients do know what they want and they want to have it, but that's not necessarily the right thing, so you have to
Mm,
kind of present all the options and gear them toward the right direction. So for example, one of the good things about female pattern hair loss about 50 is that there are some more options, whereas if you're below 50, you really don't have those options. So for example, there's a pill that guys take called Propecia Finasteride. We typically do not prescribe it to females below age 50 just because of the fact that you don't want to get pregnant while you're on the pill, you know.
oh, okay.
So, but if you're above 50, usually that's not an issue, usually. So, and that pill really works really well. Finasteride for females above 50 is very effective. It's very
Um,
effective. And, I'm a very big fan of it, and I usually recommend it. Um, and also, studies have shown that you could actually take a higher dose than guys can. So guys typically
oh,
take the 1 milligram, and females could take the 2.5 milligrams. In the US, there's no 2.5 milligrams, but we usually prescribe the 5 milligrams and they cut it in half.
break it in half.
And,
Yeah.
and for the most part, it's actually a pretty safe medication, actually. There's this, FDA in the US has put the risk of anxiety and depression on it. So we kind of have to legally discuss it with our patients, but it's actually pretty rare, and most of my female patients don't have any side effects from it. Now, if someone doesn't want to do the oral finasteride. There's the topical finasteride. I mean, that's
Oh,
why, I mean, we found a company called Happy Head, and Happy has topical finasteride, and females use it. And, it's, in studies, it's been shown to be as effective as the oral, and it gives them good results. So you really have two options right there. And if someone is below the age of 50, we usually recommend spironolactone. Have you heard of spironolactone? It's a
well, I'm not sure.
it's a very commonly used drug for It's a very commonly used drug for acne, actually, and
Oh, okay.
patients do quite for adult hormonal acne. And a low dose is great for adult hormonal acne, and high doses is great for hair loss in females. I have thousands of patients on it, and people really do pretty well. You do have to watch out what you eat, like stuff that are high in potassium you shouldn't eat. But for the most part, females do very well. And in the US, a lot of females are on it. So pretty safe drug
Mm.
for the most part. Just don't get pregnant on it again.
So this is uh, boosting the hair growth.
Yes, they're testosterone blockers. So, and by
Oh,
blocking testosterone, you allow basically your hair growth. In fact, I think there was a large study by UCLA that showed that I think the spironolactone was at 50-50 effective. So if you took it 50% of the time, it maintained the hair, and the 50% of the time, it regrew the hair. So which is good.
mm,
So if someone's
mm.
in their 20s or 25 or 30s and losing hair, is worthwhile to go on it and give it a try.
And it's not going to give me a beard, is it?
It's not gonna give you what? A beard? No, 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 no. In fact, it's actually used for PCOS, actually,
Oh,
for
is it now?
patients that have a lot of PCOS, like
Yeah.
a lot of facial acne and facial hair growth. It actually used for PCOS. That's one of the drugs that is used for. So I see a lot of patients who have PCOS and have not been treated. So I usually do, try to kill two birds, with one stone. Just to put them on the spironolactone. Sorry, put them on the spironolactone, and we treat the PCOS and also treat the hair loss as well.
Yeah. Oh, well, I mean, this is the thing. If there is something that you could do and it would make you feel better to do it, and it's not going to break the bank, then these seem like sensible options.
I agree.
You know, yeah.
I absolutely
It,
agree with you. Yes. Look, they're not, look, you always have to, the risk and benefits. Look, if it's not very
mm.
deadly and it's pretty safe and it's going to make you feel better about yourself, why not?
Yeah, yeah. Well, I'm all for that. We take all the natural approaches we can with managing our stress
Right.
and taking the nutritional supplements.
Right.
But there are times when intervention is by far the best thing or the only thing, perhaps, that we can do. And under those circumstances, it would be silly not to give it a shot, perhaps, if it's going to. I mean, like I said to you at the beginning, my hair is so part of me, and to be honest, like I said, I don't feel like me when my hair's not looking looking good.
Right.
But I mean, there are women who look good with shaved heads. Sinead O'Connor, I don't know if you remember that pop star.
I remember
She,
that.
yeah, she certainly could rock a shaved head. Uh, but we're
Mm,
not all quite that fortunate, are we?
some people could, most people can't. But look, when someone comes to my practice though, we usually actually present them with the most natural options first. I'm like,
Mm.
look, do the vitamins, do the collagen, do the iron and vitamin D, do the protein, and also another thing, derma roller. Derma roller is
Oh,
a micro needling roller that has
oh,
about
is it?
500 spikes at the tip, and you gently people use it for the face to stimulate collagen production, but you could also gently roll it on your scalp. That also increases blood flow. And again, there's no medications. I mean, it's just simple and it's natural. So I like that as well. And sometimes I might just start with the most basic thing. Just use Rogaine over the counter. Just keeping things very simple. And I usually tell them to come
Mm.
back in 3-4 months. and just see how they do. And a lot of times it helps, and sometimes it doesn't. And that's when you go to the next step of,
Mm.
either giving the option of topical happy head, which is topical Rogaine, prescription Rogaine, or then you go to oral options. So, you don't have to necessarily jump to oral right away. You kind of, have this, you kind of do the holistic approach, and vitamins, and then you go from there. And then there's some patients that want to do injections, and that's a different topic that we'll talk about later on.
So we've got a question from Hugh Griffiths, and of course we're not ignoring the men, the husbands at home or at work, wherever they might be. So, what are the options for males with alopecia caused by eczema? And
And great,
Hewell's 52.
52. So great question.
Mm.
So typically, so on the scalp, you could get like a bunch of different inflammatory conditions: eczema, psoriasis, dandruff. They're really all on a spectrum. Um, so the key is you have to treat that inflammatory disorder. Basically, what I said at the beginning, you have to treat the inflammation, because if you don't treat the inflammation, then basically the inflammation is going to kill and damage your hair. And the way to treat it is, in his case, he probably needs to use a topical steroid. In the US, we have something called clobetasol, which is prescription. Is a
Mm.
dropper that you rub it into your scalp basically twice a day, every day, for about 2 weeks, and that will really reduce the inflammation. And by reducing the inflammation, you just have better, healthier hair and better, healthier scalp. So see a
Yeah,
dermatologist and treat the inflammation. I don't like
yeah,
oral steroids, but topical steroids should do just fine.
yeah. I mean, you talked about the roller. I like
Yes,
that idea.
yeah,
Uh, stimulating the circulation to the scalp. Uh,
absolutely.
I I'm an exercise professional, and so whatever we can do to improve the circulation in the body, if we're moving, it's going to improve the circulation everywhere.
Yes, sure.
But specific techniques to improve the circulation locally, again to shift the inflammation as well. We'll sort of get rid of those byproducts of inflammation if we're stimulating the circulation, won't we?
Right, yes, exactly. That's very important. In fact, I'll tell you something else how to stimulate increased blood flow. Most people
Okay.
have probably have not heard about this, but Botox on the scalp.
Really?
I don't make it up. You could just look it up yourself. There are three really good studies now. The most recent one being in females, actually, Botox on the scalp in females. The idea is very simple. It's called the scalp tension theory. So some people believe that one of the reasons people's hair starts falling out is because when you get mad or stressed, your scalp tenses up, and that
Um,
constricts the blood flow, shuts it down. There's no blood flow getting to your hair. You're basically cutting off the nutrient supply to your scalp. So by
mm,
injecting Botox in the scalp, you relax the muscle and you open up those blood capillaries, and as a
um,
result, you have more blood flow. That's a simplistic explanation of it. And look, I have patients that I do it on, and there are clinical studies showing demonstrating that go back almost
mm.
10 years, probably longer than that now.
Well, there's nothing more relaxing than a scalp massage, I must say.
Sure. And you know what? There's
Mm,
actually in the United States, there used to be a bunch of clinics where, you used to go in, Regenix, used to go in, they used to really intensely massage your scalp. Um, I think some patients found it effective. I think there are better ways now to kind of do it, like dermal roller.
mm,
There's also like a machine called hydrofacial where they go in and basically they kind of clean up. It's kind of like a facial for your
mm.
scalp,
Oh.
and it stimulates more blood flow. You massage it, you clean it out. Look, and I think all this stuff helps. Look, we live in a world where you just can't look at only one thing and say, oh, this is the only thing that's going to work for you. Typically with medicine, just like everything else, is a holistic approach, and you're adding
Mm,
multiple different things to the regimen to really make it work. And the same thing for scalp. Your diet is important. Increasing blood flow to your scalp is important. Reducing the stress is important. What you eat is really how you look like. So we always encourage people, to reduce processed foods, reduce alcohol, reduce
mm.
vaping, reduce smoking, all that affect your hair.
Well, you know what? I couldn't have said it better myself. That's that is entirely my approach to health and wellness in the broadest sense, and that we, you know, working together as well, even with allied professionals to
Right.
get the best recipe for our clients. You know, sometimes like you work with your brother, and between you, you can offer so many more options for
True.
people.
That is true.
And yeah, so thank you so much for
Of
your
course.
time
No,
today,
no,
Dr. Ben.
of
I
course.
thank you for these wonderful tips that we've been sharing. And I know that you have your website. Tell us about it.
Yeah, so our website is happyhead.com. Again, we offer topical, prescription grade hair loss solution for both male and female. And it kind of goes to my point at the beginning where, you want to have this holistic approach. Not everyone wants to go on an oral medication right away. So you do the diet, then you do the topical stuff, and then you go to oral. So that's
Yeah.
our until a couple of years ago, the topical really was not talk about that much. So our company focuses on customizable prescription grade topical solutions for male and females. We've had it for 2 years, and we're still the only customizable solution on the market.
Oh, well, that's a brag worth bragging about, isn't it?
Yeah. Thank you. Yes.
Thank you so much for joining me, and
Thanks so
I
much.
look forward to you know, learning more about hair. There's so much to learn about all these different bits of us, and hair is just a part of it. So thank you so much again.
Thanks for
Do
having me.
have a wonderful rest of your day in
You
Los
too.
Angeles,
Thank you so
and
much.
thank you
Have a
again. Bye
beautiful
for
day.
now.
Bye.
Thank
Thank you.
you. Bye.